Hiya, I'm Teoh, specialist in obstetrics and fertility care. Has been a while since I have time to do a video. Today I'm going to do a short one to talk about a few common concerns where I receive calls very often, sometimes every day, from my patients. Now, number one is bleeding in pregnancy. In theory, in pregnancy, women should not have bleeding because there's no menstruation, the lining is protecting the womb, and thus you don't need to have period, there's no bleeding. But bleeding is very common in pregnancy. Can range from very early pregnancy, can range to later in pregnancy, can be just spotting, can be more, the amount is more, like more bleeding. Generally, if the bleeding is more, then we get a bit more concerned. If it's spotting, most of the time it's fine. Now, for my patients, if they say, they mention they have bleeding, I'll get in touch with them to see what's happening. Often I bring them to the hospital to do a quick check. For example, even very light bleeding, most of the time, maybe there's some blood vessels on the cervix, the neck of the womb, that the blood vessels that pop or rupture. Then there's a bit of bleeding. If you check everything is fine, then it's okay. Most of the cases it's like that. However, in a few cases, even light bleeding, what we notice is the cervix, for some reason, is not competent, not strong enough to hold on to pregnancy. And recently, I have needed to put in stitches to strengthen the hold on to pregnancy for pregnant moms to be. There was one twin pregnancy. I put stitch on 21 weeks. She came in for a bit of bleeding. So we checked, we realized the cervix opening up, put a stitch on and held on for many, many weeks. The twins have delivered now a few months after the stitch was put in, and they're gorgeous, they're healthy looking, beautiful babies. I have a patient, even 12 weeks, came in, with a bit of bleeding and get scanned. They realized the cervix starting to open up, and I put stitches on. I mean, those cases are more worrying ones. That's why when there's bleeding, often I ask my patients, look, just call me. If any worry, I'll bring you in to do a quick check. Bleeding can be also from the pregnancy, especially later in pregnancy, when the placenta, if it's too low, because placenta previa, if it's too low, then you worry about bleedings from there. Can be quite serious if the bleeding is very heavy. Bleeding can be from the placenta, abruption. Placenta usually is stuck to the wall of the uterus, the womb. If it starts to come off a little bit, you can have bleeding, and that can be associated. Sometimes patients may say they have pain, but not always the case. And you want to check to make sure baby is fine. But majority of cases we check, patients are fine. I'll say 80-90% of cases are fine, but potentially it can be something serious. So this is about bleeding. Second thing I want to talk about is pain in pregnancy. So pregnancy is basically, women carry, which is a heavy fluid, and baby and placenta add up, which is quite heavy on the body. And also the hormone released from the placenta is called relaxin. It's meant to open up the pelvic floor, loosen the joints so that, for baby to fit in during delivery. So placenta releases this hormone called relaxin. A combination of everything plus carry this big load. I don't think men can do this job. Kudos to women, the sacrifice for family and children, the love they put in to carry this big load, when they're pregnant. So pressure on the pelvic floor with the hormones, so pressing on the nerves, on the ligaments, and the joints are opening up a little bit. And also the pregnancy comes all the way up, pressing on the lungs, the diaphragm, the separation between the lungs and inside the tummy. So we call the diaphragm, and that itself is quite uncomfortable as well. Often they can't take, when their pregnancy very advanced, then it's very difficult to take a deep breath in. All those things does cause discomfort and pain. And pain can be those pain is from, we call musculoskeletal pain, can be pressing on the nerves, which will sometimes cause this shooting pain down the leg, which is the nerve being compressed or being pressed. Pain can also be from the bowel, if there's tummy upset or anything. Sometimes patients may get constipation during pregnancy. The bladder, baby is pressing on the bladder, they go to the toilet very often, or sometimes there could be infection of the bladder as well. Infection of the kidneys can happen. Tummy bug. Of course, we never forget Braxton Hicks as well. Braxton Hicks basically is a forced labor. The womb is practicing to contract and such. Often Braxton Hicks, they are not so close together, maybe one every 15 minutes. They're not very strong, of course, and often they settle down. If patients try to distract, do other things, moving a little bit, and then do other things, take a bath, shower, or anything, sometimes it settles down, and Braxton Hicks do settle down. But if, of course, the other thing we worry about is labor. If the kind of cramps from the womb, contractions getting stronger, more frequent together, getting stronger, then we worried about labor could be preterm. If they're term, that means they are due around their due time. After 37 weeks, generally we say it's term. Before that, we call it preterm. That can be if combination of water is gone, the water is broken, the leaking of fluid, then of course, it's more a sign of labor. So when patients have pain, then I'll ask them to contact doctors like myself, obstetricians, or the hospital to get a story to say, look, what kind of pain? Is there something we need to worry and such? Again, if there's any worry, come into the hospital, we do a check to make sure everything is fine, make sure baby is okay. Combination pain and bleeding, we worried about abruption, as I mentioned earlier on, where the placenta is coming off the wall of the womb itself. And often patients come in, we check again, just like the bleeding, we check, we say, well, actually it's fine, it's ligamental pain, the muscle pain and the joint pain. Then if you give patients support and everything and baby is fine, they can go home. Often that's the case, but something more serious can happen. The other thing I'm going to talk about today is fetal movement, baby's movement. Usually patients start to feel baby's movement depending on whether you have been pregnant before, and also depending where the placenta is, the afterbirth. If it's at the front, it kind of dampen the feeling a little bit, so you may not feel that early. Typically women start to feel around 18, to, if placenta's at the front, first pregnancy, it might go on to 22, 23 weeks before they start feeling the baby movement. And the movement should increase slowly, feel a bit more rigorous, a bit stronger, should increase, and from 20-something weeks, early 20s to around 30 weeks. After 30 weeks, it should be stabilized. Should feel frequent movement every day up to when baby is born. The movement should not decrease even when you're due, when there's not much space, maybe you lack of big kicking and such, maybe not much, you don't have much rooms to do that, but you still can feel shuffling around and baby still move around your arms and the legs. So movement should still be the same until the baby is born. It should not decrease even towards the very end. Now, some people ask, look, do I need to count the movement and such? And, we look at data. It's very hard to count, and different women feel very differently. So it's very subjective. What I let patients know is, if you feel that, get used to the pattern of how baby's moving. If the pattern changes, you think, look, yeah, it's not the same as few days ago or even yesterday. Usually at this time I should feel this such and such amount, or about this much, but I don't feel that much. I'll say, look, contact the hospital, come in and get checked. Most of the time it's fine. Again, 9 out of 10, it's just not feeling much. Often come to the hospital, have a cold drink, or have some food, and come in and check. Baby's kicking around, we are fine. However, sometimes, that's why we advise patients, any worry, I tell my patients, look, let me know. We need to come in and check. 9 out of 10 times, fine. You go home, it's okay. But sometimes something more serious can happen. Like over the weekend, I had to deliver a patient just shy of 37 weeks, reduced fetal movement. Come in, we check, and we start to see baby's happy, and then, we do the heart CTG, the heart tracing, and then at times you see there's a baby is complaining, a big dip, the heartbeat slows down for a few minutes before picking up again, and we monitor for hours, a few hours during that day, and after that I notice, look, it drops again, and I say, look, let's do a cesarean section, and you notice the cord is quite thin. Some babies got thicker cord. It's just the way baby is born. The cord is formed and such. Some cords are thicker. That means you try to, when you squeeze the cord, the blood stops flowing. So a thicker cord, a bit more jelly-like, it's harder to squeeze, then less effect on the blood flow. Some cord are a bit thinner. That means when you squeeze, you don't need to squeeze it hard, then the blood stop flowing. When the blood stop flowing, then of course baby will complain. There's not much oxygen and such. So we noticed the cord is quite thin, but baby is beautiful. Came in a perfect timing, just 36. Baby is doing very well, around 37, just a few days before 37. Beautiful baby kicking around. You're worried about, if we don't check, then something more serious can happen even a few days later, or sometimes could be even sooner than that. Again, most of the time it's fine. All those things, work closely with the team, with the hospital team, about bleeding, pain of fetal movement of baby. All those things are very common concern. 9 out of 10 times, again, their patients are fine. But that's what we are here for, to prevent anything more serious. Call us, like for my patients, call me anytime, email, call the hospital 24/7. We'll be there to make sure things are fine. And this is what a good obstetric care is. Everyone should receive those kind of good care to make sure mom is fine, baby is fine. It's very important. Most of the time, again, it's okay. Don't get too worried. Just do the routine, get checked. It's fine. Go home. There's no need to panic or anything. I want to, and encourage and reassure you or my patients or moms to say, look, most of the time it's okay, but just like anything else, better get checked, go home when things are fine. You don't lose much apart from a trip to the hospital or a chat with the obstetrician. Okay, that's it. Bye-bye.